Hello, my name is Dr. Nitiraj Oberoi. I'm an orthopedic surgeon at Dharamshila and Narayana Superspeciality Hospital at New Delhi. Today we shall enlighten you about joint pains, which are very common, and I'm sure you have questions and concepts about it. Joint pains are caused by various things. For example, we classify them based on either mechanical joint pains, which are related to pains which come as a result of derangement of joint alignment. Then there are inflammatory reasons, so that's commonly known as rheumatoid arthritis and other kind of inflammatory arthritis. There are rarer kind of reasons for joint pains, which could be referred joint pains. So the problem could be elsewhere, but the pain could be in a nearby joint. All of us who walk are at risk of developing joint pain. But people who have not exercised regularly, do not take care of their posture and habits, and those who suffer from congenital problems or from inflammatory problems are more at risk of developing joint pains. Interestingly, there is a sex distribution as well. It is commoner, especially weight-bearing joint pain is commoner amongst ladies. Children also get joint pains, and in those cases it's mostly inflammatory in nature or as a result of overuse from sports. Joint pains is a symptom. So if a symptom lasts a long time, which means if it lasts more than 4 or 5 days, is persistent, is also associated with some kind of swelling, fever, inability to walk or limp, then one should consult a doctor for that joint pain. We must understand that joint pains happen as a result of certain misadventures that we do with ourselves, and sometimes unfortunately as a result of some diseases that we may get. So prevention involves essentially preventing disease or identifying the disease early and trying to find treatment for it. As far as mechanical or injury-based joint pain is concerned, we must always understand that we have to exercise regularly, we have to take good care of our posture, habits, sitting habits, and sometimes we have to make sure that allied medical conditions are taken care of. Osteoporosis means a weakness in the bone. So let's say a joint is like a tiled surface. The bottom of the tile on which the tile is resting is the bone. If the bone is weak, the tile will break faster. So people who have got osteoporosis have more joint pains, have a faster progress of arthritis. So the first management line of arthritis is to improve bone quality. When bone quality improves with exercise and medication, automatically joint pains come down. Joint pain does not mean that you need to have surgery. Most joint pains will be managed non-operatively. It involves exercise, physiotherapy, rest, and some medication. Medication is of two broad categories: pain management medication, and if you have a disease like a rheumatoid arthritis, then disease modifying agents. In between lie what are known as supplements. These are collagen analogs or glucosamine analogs, which help to regenerate and retrieve the cartilage lining of the joint. And we should remember, loss of cartilage of a weight-bearing joint equals arthritis. If we are unfortunate to be advised surgery, we can still do something for preservation of our joints. We don't have to replace all our joints. If the patient is young and if the disease is confined to one compartment, we can do what are known as osteotomies. These are bone cutting procedures which realign the joint, and we don't have to go in for surgery. In the unfortunate circumstance that we have to go for joint replacement surgery, now replacing half the joint or only the diseased portion of the joint has come back in a new vogue with new technology and hence better success. Most people understand when a doctor advises you a surgical intervention for your joint frame, it means a joint replacement. So joint replacement essentially means resurfacing the joint. It's putting caps on the diseased bone surfaces. This has been a process which is now nearly 40 or 50 years old, has found a lot of success, and a lot of research has gone into improving the quality of what we can offer you. Surgical procedures, anesthesia procedures, pain management and rehabilitation has undergone a sea change in the last few decades. The surgical intervention in the form of joint replacement finds a lot of takers today with very good results. Joint surgery, like all other branches of science, has recently seen a lot of new changes. We have had new metals, we have new biological designs which save bone, which give you a feeling of a normal joint. Also, we have newer surgical procedures which reduce the amount of bone to be cut and soft tissue to be cut, which makes your rehabilitation and return to activity faster. We are using computer navigation to give us a better alignment of the joint. Remember, the joint has to be aligned to the rest of your body. If it is aligned to the rest of your body and your limb, it will produce longer and better results.